So thank you all for joining us today. This is one of our series of our Housing is Working group. We hold these meetings on the second Tuesdays of the month throughout the year, and we do it on a variety of topics with our PHA members and a number of our partnership organizations as well, who are welcome to join us. So today we are talking about the Medicaid redetermination that will come up at the end of the public health emergency as it ends. Thank you all again for being here today. I just have a quick couple of announcements. We are just about to launch our Save the Date for our Spring Housing Is Summit. This will be held in May, and it's going to be on site this year, in person, with some virtual options as well. So keep an eye out for that. And at the same time, we will be with the Save the Date, we'll be launching requests for summit proposals. So we'd love for all of you all to think about whether you'd like to put together a presentation for our spring summit. So thank you all for joining again. I'm sorry for any confusion about any cancellations on Sunday. We had a little logistics snafu, but we're glad you all could be here. And with that, I'm going to turn it over to Andy and Emma from UnitedHealthcare. And I believe Andy's going to kick us off.
Great. So thanks so much, Camille. Great to see you as always. And hello to my CLAFA friends. Always a pleasure to get together with you guys. And I think, just a note of gratitude to start that, we at UnitedHealthcare, we're just hugely appreciative of our now many-year-long ongoing partnership with CLAFA, you, Camille, Sonia, and team, and a whole host of the amazing public housing agencies that are part of CLAFA. So just a huge thank you and kind of onward as we go into 2023. So I'm going to be brief because Emma is our expert on redeterminations, not me, but just wanted to share that as we talk to you today about Medicaid redeterminations, I think I've had the good fortune to work with so many of you over the years and thinking about that kind of fundamental notion of housing as healthcare, and yet we have these kind of disparate systems and other things. And so we're delighted to talk to you all today about redeterminations and the kind of coming end of the public health emergency, in large part, because we do come from two very different systems. And so, you guys aren't necessarily, just like we're not focused on, Section 8 housing choice vouchers all day long, you guys probably aren't focused on the public health emergency all day long. So excited for the opportunity today to have Emma talk through kind of the efforts that we have underway that are kind of member and plan agnostic, you should know. So this will be across the board for Medicaid as Emma talks, and she'll mention that as well. But the final comment I would make is just, and this is in particular in expansion states, as we know from some of the data, there's a huge overlap between people in publicly assisted housing that you find folks are providing housing to and people eligible for or on Medicaid. Upwards of 90% in some communities. So the impact of what Emma's going to talk through for you guys today, I think is actually fairly to very significant for a lot of your residents and their ability to access healthcare and have insurance. So with that, Emma, I think I will turn it to you and look forward to the conversation and appreciate you guys.
Sounds good. Thank you so much, Andy and Camille. And I'm really excited to be able to be here with you all today. I'm Emma Lind and work at UnitedHealthcare, as both Camille and Andy mentioned, and I'm a director of strategic solutions and redeterminations. And so my day job is really figuring out how we can help individuals on Medicaid retain their coverage following the public health emergency, which is something that we will talk about today and is very near and dear to my heart. As Andy mentioned, this is all plan agnostic and carrier agnostic. And so while I do work at UnitedHealthcare, the strategies and the information that I'll share today are definitely industry-wide and apply to every stakeholder within the Medicaid industry. So today we'll walk through first what the COVID-19 public health emergency is, and you may hear me refer to it as the COVID-19 PHE, and then how that really relates to redeterminations and what redeterminations are and what individuals on Medicaid experience when they have to go through a redetermination. We'll then walk through some of the industry challenges and opportunities. And again, when I say industry, I mean the entire Medicaid industry and really anyone who is a support system for individuals on Medicaid. Next, we'll walk through some strategies for supporting those Medicaid members and any individual on Medicaid across the country, and then end with questions here. So our overall goal when it comes to redeterminations, and I think something that everyone on the phone would agree with, is that our #1 priority is making sure that all individuals who are on Medicaid maintain their health coverage following the public health emergency. And so we'll dive into what the public health emergency is, but I want to answer a couple of questions up front. So first, why redeterminations and why now? Redeterminations is something that each member will have to go through to certify their eligibility for Medicaid and be able to receive that coverage from the state government. And during the public health emergency, which is very understandable, states have not been able to term members from their Medicaid coverage, really with the goal of making sure that as many people have access to health insurance and therefore access to health care as possible as we go throughout the COVID-19 public health emergency. So that really is our main goal, is continuity of coverage for all individuals on Medicaid across the board. So first we'll walk through what the PHE is and then what redeterminations are to kind of set the scene, and then go through some of those industry opportunities and challenges, as well as how we all can help support Medicaid members across the country. So first of all, what are Medicaid redeterminations? You may hear this popping up, especially as it's coming to the forefront of national consciousness with the public health emergency. Certainly with elections being today, it may be in the news, and really, what does the extension of the public health emergency mean, and what are the impacts to those on Medicaid? So when we talk about Medicaid redeterminations, it's really referring to the process by which anyone on Medicaid has to recertify their eligibility for Medicaid. And because it is administered by states, that's the process whereby states are saying, hey, are you still eligible to receive these benefits that are funded from us? And if not, how can we help you get to the coverage that you are newly eligible for? And so the Medicaid redetermination process really happens by an individual submitting information about their income or assets or other information that would be pertinent to any qualifying criteria, and the state making a determination on whether that individual is eligible for Medicaid. Now, if that sounds very complicated, it's because it oftentimes is. And so our priority is, how can we make this as simple as possible and really help members across the whole spectrum as they go through this process. And I know that's a priority that both the Biden and Harris administration, as well as states, have really echoed as well. So when an individual reports an income over the federal poverty level, which in states that have not expanded Medicaid is really the threshold for Medicaid eligibility, or if they report that they no longer meet any other eligibility criteria, such as having a dependent suddenly turn the age of 19 and no longer be a minor anymore, that means Medicaid benefits are likely to be terminated. And so as we go through this presentation, you may also hear me refer to this as recertification or renewal. Really, it all just means the process by which someone will recertify their eligibility for Medicaid. So what does this actually mean when we say recertification or redetermination? What do Medicaid beneficiaries need to actually do? And like I like saying that, and so like so many situations with Medicaid, it really depends. And that it's dependent on whether the state has enough information about that member, about their assets and income to say, you know, we've got enough information about Emma, we can go ahead and recertify her for another year of eligibility with Medicaid. Or if they need more information from those individuals to say, do they still qualify to be on Medicaid? And so when I talk about that process by which, you know, states may have that information about someone, we call that auto renewal or the ex parte process. And that really just means that the state is able to make that eligibility determination without any action needed on the part of the individual. Now, when the state is not able to say, okay, we're able to just auto renew someone, they will request that beneficiaries or individuals on Medicaid complete an application for redetermination. And this varies by state. In some states, it's paper only for those applications, such as Minnesota, where I happen to be right now. However, in most states, it actually is, people can recertify either online, by paper, or in person. And so we'll talk about some of those strategies for how we can assist individuals on Medicaid a little later on today. These individuals will also need to provide proof of income or resources to prove that they still are eligible for Medicaid. And actually, I had someone ask me yesterday, you know, if I were to lose my job today, would I be eligible for Medicaid because my income would technically be, you know, below the FPL if I don't have an income? Medicaid also looks at someone's assets to see, you know, to get that holistic picture of where that individual is, to be able to determine whether they are or aren't eligible for Medicaid. And as I'm sure you are all realizing, it's a pretty complicated process, and there's a lot that goes into Medicaid eligibility. And so the ultimate determination of Medicaid eligibility ultimately lies with the state. And so when we talk about redeterminations and Medicaid members, so much of our actions are geared toward how can we make sure that individuals who are on Medicaid right now are able to get their correct and updated information to states. If members don't renew in time, maybe they didn't turn in their paperwork or they forgot, there's typically a grace period that allows states to accept documents and go ahead and backdate the Medicaid recertification date for individuals, realizing that, yep, you know, life happens and sometimes there's a miss. States have accounted for that as well. So when do Medicaid redeterminations usually happen? Again, it depends, but really typically every 12 months. That means recipients usually recertify every year, and it usually occurs in relation to when they started to receive those Medicaid benefits. So for example, if I signed up for Medicaid in November of a couple years ago, my recertification date would most likely happen every November then every year after. But in some cases, states require more than a yearly recertification. And this is something that the administration is looking at as well, because as you can imagine, there's a lot of administrative work that goes into that, and asking the beneficiary or individual to submit information to the state. And so really the goal is how can we streamline that as much as possible and make sure that people don't have to go through the process if not absolutely necessary. So that's a bit about redeterminations overall. And when we start introducing the public health emergency, this really comes in hand because of the Families First Coronavirus Response Act that was enacted back in March of 2020. And so that act actually said, you know what, states, you're not allowed to term members because we're going to give you extra funding to keep those members on your Medicaid rolls. And so that people don't lose access to health insurance during a global pandemic. And so we've seen states really adhere to that and say, yep, we're going to keep that federal funding, that enhanced federal funding that comes with the stipulation that we don't term any of our members. And as a result, we've seen a backlog of Medicaid members really build across all of the states. As we'll go into in the next slide, there's about an 18 million growth in Medicaid during the public health emergency since began back in March of 2020. Since the public health emergency began, we've seen 11 extensions, and you may have heard about this in the news. And so we are really watching this closely because the end of the public health emergency would traditionally mean that that is the beginning of when states could start terming members and redeterminations could begin again in earnest. Currently, the public health emergency end date is set for January of 2023. We should be hearing within the next week or so if that's going to be the actual end date. If we don't hear anything, it'll likely be pushed out even further. And so I don't have concrete information on timing. It's always, been a question mark for the last couple of years or so. But we are watching the situation very closely because that will have real impacts to individuals who are enrolled in Medicaid. If the public health emergency were to end in January, that means the first date we could see members terming from their coverage would be February 1st. And so that's really what we're looking at is how do we make sure that we are, as a community of people and organizations that are supporting individuals on Medicaid, how can we make sure that they have the resources they need to go through the redeterminations process once that begins again? So CMS has been looking at this and saying, what kind of guidance can be given in terms of best practices for going through the unwinding and making sure that these members maintain continuity of coverage. And so they've set forth a couple of guidance points here. The first being states can take up to 12 to 14 months to clear their backlog. When the public health emergency ends and states start with the redeterminations process again, we won't see a huge cliff of people losing coverage. And that's because CMS has really encouraged states to take an approach where they redetermine their population in monthly cohorts instead of all at once. And so we're seeing a lot of states lean more toward clearing their backlog across the course of 12 months, as opposed to a shorter time period of 6 or 9 months, which means that will help both in state capacity, but then also help us with educating and outreaching to the folks who will have to go through the redeterminations process and making sure that they have the resources they need to do that. Second, all states are required to make an additional redetermination after the public health emergency ends within 12 months. And so that means if the state has been conducting those eligibility determinations in the background during the public health emergency, but not terming anyone, they will have to do it again after the end of the public health emergency. And then finally, states are required to facilitate the transition for individuals who are determined ineligible to other insurance affordability programs. And so this could be this could mean qualified health plans or the exchanges, or if the individual is newly eligible for employer-sponsored insurance, helping make sure that they are able to access that as well. As I spoke about a little earlier, the Medicaid enrollment has increased to over 81 million people during the public health emergency. And actually this data is from April, and now we've seen it grow by over 18 million people. And so really, when we think about the backlog that states will have to work through and the volume of people who will need to go through redeterminations, that brings with it a lot of operational challenges that are good for us to know so that we can get ahead of them and really help those members who will be recertifying. So that brings us to our industry challenges and opportunities. There are several unwinding operational challenges with the states for redeterminations. And so while this might not relate exactly to any challenges that our organizations would face, it's good for us to know so that we can support our members and residents on Medicaid because they may be losing their coverage during this, and we want to make sure that we're getting ahead of these challenges. So first, the Medicaid population is notoriously transient, and so wanting to make sure that we're helping them update their contact information. The thing that keeps me up at night is, if there is a member who maybe moved and didn't think, oh, I should have called the state and let them know that I moved, or they had changed phone numbers, that is something that is very understandable that they did not update their contact information with the state. And so how do we really work with the outdated contact information to make sure that the state is able to reach people to let them know that it is time for them to recertify. Second is late or incomplete paperwork. And so if people have to submit an application to the state, maybe they don't attach a proper document that the state needs to make their determination, or they don't fill out the entire application. Those are some challenges that states will face as well that will make it more challenging to go through the redeterminations process. Third here is underutilization of automated renewals, or those ex parte renewals that I mentioned earlier. Ex parte renewals are really helpful because they don't require the individual to take an action to recertify. And so the more that ex parte renewals are used, the less that means there's room for people to lose coverage because they didn't do what they needed to do to recertify, not because they could be still eligible, but if they don't take those actions and the state needs them to, then they could lose their coverage. And that's really what we're trying to avoid. Fourth here is limiting renewal options or use of data. And so again, talking about really accessibility when it comes to the recertification process, and how do we help make it as accessible as possible to all individuals on Medicaid. And then fifth is simply state capacity issues. We've heard from some states that there are concerns about the staffing and frankly, the ability to get through the backlog in a timely manner. And so that's a challenge that states are facing too as we come up against the end of the public health emergency. And so while there are certainly challenges that are brought forth by the public health emergency ending, I think there's really a lot of opportunities for the industry at large to support individuals who are on Medicaid. I see this as a new era of collaboration between states, health insurers, community organizations such as CLAFA, and then members and residents, really to make sure that we're all working together to best support that member or resident. So first is really the focus on maximizing continuity of coverage, making sure that if someone loses their coverage or is no longer eligible for Medicaid, then they are presented with an option that they are newly eligible for. So for example, if someone loses their Medicaid eligibility, they are likely eligible for enhanced subsidies through the exchanges and could be eligible for a $0 plan on the exchange. And so how do we help them know those options exist and get past those perceptions that I didn't have to pay for Medicaid, and there may be options that they could be on for health insurance that they also do not have to pay for, and how do we help them find those lowest cost options? Second is leveraging learnings from the public health emergency and the resulting pause of redeterminations to really improve member experience. That's really what it's all about, is improving the member experience. How do we make sure that we are making this process as simple as possible for members and residents and people in general on Medicaid? And just taking all of the guesswork out of it for them and going beyond and meeting them where they're at and really being able to support them. Next is establishing new partnerships and strengthening existing partnerships with the common goal of ensuring any member maintains coverage. This is really what the spirit of this presentation is about, and that's why I'm so excited to be talking with CLAFA members, because this is really where we can take that full community approach to supporting individuals on Medicaid. And then finally, exploring opportunities for states to extend continuous coverage to ensure continuity of care and address social determinants of health issues. Again, really taking a step back and saying, this may have been how we've done this in the past, but really how can we do it the best way possible for the individual going forward? So there's actually some strategies for supporting individuals on Medicaid that I would love to share, and then have some ideas for how we can all partner and how you and your organizations can support your residents on Medicaid as well as we go through the unwinding. So as we look at best practices for supporting Medicaid members, there are a few very concrete things that stakeholders across the industry can do. So first is proactive outreach to members making sure that any information that we have about individuals, we are able to reach them. Equally important here is making sure that we are encouraging individuals to update their contact information with their state agency. Again, so that the state is able to reach them when they're coming up for redetermination. I would hate to think of a situation in which someone moves or has their information changed, and the state isn't able to reach them and they lose their eligibility because of that. We want to make sure that anyone who is eligible for Medicaid is able to recertify and keep their health coverage. With what Andy mentioned earlier, access to health insurance means access to better health care and ultimately drives better outcomes for our residents and members as well. Second is engaging with providers and really engaging that community to make sure that provider offices can direct all Medicaid members to redetermination's resources or answer any questions they have. Of course, we want providers to continue operating at the top of their license. And so how can we work with staff in provider offices, or for those federally qualified health centers, how can we engage their eligibility specialists to help with the recertification process as well? Third is really where CLAFA comes in, and that's the community support through partnerships with CBOs, faith-based organizations, and really going beyond and meeting members where they're at and saying, you know, we're going to make this as easy as possible for you to re-enroll and take all of the guesswork out of it. Fourth, what I mentioned earlier with the contact information update campaigns, that's huge. And I think that's really an opportunity for CLAFA members to lean in and support members as well during this time, to make sure that states are able to reach members with renewal information. And then finally, making sure that there's personalized support for all members as they navigate the redeterminations process. And so that means if someone is newly eligible for an exchange plan, making sure that they get to where they need to be to enroll in an exchange plan. Or if they're still eligible for Medicaid, how do we facilitate that process as easily as possible? So finally, and most importantly, what can members of CLAFA do? We've got a few ideas here, and then would love to hear any questions that people have or ideas that are really coming to mind as we talk through all of this. So first is updating contact information and encouraging residents to do the same with their Medicaid agency. And they can do this by going to their Medicaid website or calling their state Medicaid agency. And so as a follow-up to this presentation, we will send out a list of state Medicaid websites that can be used to give to residents and so they can update their contact information. Second, reminding people that to make sure their mail is being forwarded if they've recently changed housing locations, again, with the focus being on the fact that they get their renewal information and notice from the state when it is up for redetermination. And third, you can hold on-site contact information update drives when, whether that's having someone in a common location and really with the Medicaid website up and encouraging people to update their information or make sure that confirm their information is up to date. That's really crucial. And I think that's the most tangible way that we all can support Medicaid members prior to the ending of the public health emergency. And so those are really the strategies that we see collaboration on. But as much as I am excited to share all of this with you today, I'm really excited to learn more from you all and hear any questions you have, and would love to answer anything. So we can open up for questions.
Great. Emma, I'm going to kick it off with some questions, though I would like to encourage anybody to raise their hand or put a comment in the chat if you have a question as well. So I'm going to kick it off with, can you tell us a little bit more about the range of Medicaid redetermination processes across states? Which ones are going to be the most challenging? Which ones are the most automated or easiest to navigate? Particularly just pulling out a few of the people that are on the phone. I see people from Washington State, Ohio, and Texas. So those are, if you want to drop your state in the chat, we can also maybe touch specifically on those as well.
Absolutely. So another thing that I will follow up with is a resource that lists how states are approaching the redeterminations process and the PHE unwinding. And so that will be really good for finding out what is being done in each state, but really it runs the gamut. So in some states, there's a really high auto renewal percentage, and states are going to be able to renew most of the Medicaid members without action from that member. And so those are really some states that we are, I would say they're more aggressive when it comes to the PHE unwinding. There are some states where there will be more outreach needed to members, and the members will need to take more action. And that's really, I think Texas, we're seeing an auto renewal rate specifically. Our intel is indicating, I think 15% of people will be auto renewed. So that's a market where outreach is really key. Outreach is key in all markets, but really in those low auto renewal markets. We're also seeing some states such as Ohio conduct the redeterminations during the public health emergency. And so those states are really trying to get more targeted on who will and won't be eligible after the PHE ends. And so Ohio specifically is going to be, is taking note of who is likely to be ineligible so that they can help them find other coverage avenues that the person will be newly eligible for after the public health emergency. Other states have not done any activities during the public health emergency. They haven't done any redeterminations. And so I think those states will be a little bit more of a learning curve as well.
Great. So I'm hearing like in Texas, 85% of people currently enrolled with Medicaid are going to need to resubmit paperwork.
That's the latest. And I think that's, it really, it depends from state to state. But yes, I think we'll see a big need across all states for outreach.
Thank you. That's helpful. Now, I know that there are some maybe new subsidies for the health exchanges. Can you talk a little bit about what's kind of newly available for through the health exchanges for low-income individuals?
Yes, absolutely. So I would say that it's safe to say that a lot of the people who will be newly ineligible for Medicaid after the public health emergency, we see a lot of people on the cusp between Medicaid and those exchanges that Camille mentioned. And so the Biden and Harris administration extended the enhanced subsidies for individuals within a certain band of income above the federal poverty level. And so if someone has an income within that band, they will automatically qualify for enhanced subsidies through the exchanges. And so when we say they could have access to a $0 plan, it's with those subsidies that they would be able to have a $0 plan or a low premium plan.
Great. And those subsidies would be through direct payments, but also some of that's tax reimbursements. Is that correct?
Exactly. So we see a couple different types of subsidies. One would be the premium subsidy, where that would be taken off of their premium. And then there's also the advanced premium tax credit. And so exactly what you said, Camille, with the tax subsidies as well.
Great. So if come January, we're launched into this process, do you have a suggestion on how our members can be helping to navigate getting distracted. How our members can help their residents navigate this redetermination process? Are there places that they can refer them to help with that navigation services?
Absolutely. So each state has federally funded navigators, and their job is to make sure that they're able to help actually people enroll in Medicaid or complete their applications, or if the individual is no longer eligible for Medicaid, they are non-biased resources who can say, we think this plan is going to be the best fit for you, and actually help them enroll in other types of coverage. And so I would encourage everyone in all organizations on the call to really partner with local federally qualified health centers. We see a lot of navigators being housed within the FQHCs. since they each have at least one eligibility specialist on staff. So that's a great way to support your residents too as the PHE unwinds.
Great. I imagine that come the new year, as soon as the public health emergency ends, it may be great for us to start holding some events, particularly with our healthcare navigators who are partners on site to help manage some of those processes. Do you have any idea ahead of time what type of documents might be needed that our residents can start collecting now for this redetermination process?
Yeah, absolutely. So that's another thing that is, it can vary by state, but would encourage residents to start collecting income information, proof of income. That's a big thing that in terms of going through the redeterminations process that states will ask for. And then really visiting the state Medicaid website to see what else the state requires for that redetermination. Great,
thank you. So just kind of a reiteration of something you said earlier, as of right now, we're looking at a January end to the public health emergency, but they did promise a 60-day notice before the end of this public health emergency. And so we did the math, and Monday's that day, correct? If they're going to end it in January, we will learn yes or no on Monday. And so we see a lot of this change might be impacted by this current election today. We know that it's kind of housed within decisions are being made right now within the executive branch of the federal government for kind of whether this is going to happen or not. So if we don't get that notice on Monday, do we think it will then be extended another 3 months? What's kind of our expectation then?
Yeah, that's a great question, Camille. So I would say it's unknown. And I think in the past, the public health emergency, each time it has been extended for a period of 3 months. I think we could see another 3-month extension, or pending the outcome of the election, they could choose to approach it differently. We just don't know exactly what that looks like yet. And so since I don't have that insight, I can't say definitively what it will be, but if we don't hear, I can say that if we don't hear anything by Monday, or if we don't hear anything from the Department of Health and Human Services 60 days prior to that January date, if people watch the recorded version and they're not watching it on November 8th, then we can assume that the public health emergency will not be ending in January and will end at a later date. When that date will be, I can't say because I don't know.
Sure, it's all a guess. There's very few people who do, and they're probably in the White House right now. Wonderful, wonderful. So I have a question from Andy to Olive Klappa. He was saying, I assume that you all have income verifications and maybe other needed information. Is this correct? And, Andy, I don't know this information offhand, but I'd be interested to see if some of our members can pipe up. Do you all typically have verified income on hand? I don't know if we're going to get any volunteers.
I can try and take a stab at it. Yeah, I mean, sort of like part of the annual review or every other year review will be getting income verification. But one thing that probably most, if not all, PHAs will not necessarily have is knowledge of what exactly the medical benefit that any particular person is on. I mean, I don't think we know, for instance. I mean, we in aggregate we know what percentage of folks are on Medicaid or Medicare because of the relationship that we have with public health, but we don't know necessarily individually whether someone is on Medicaid right now, for instance.
Thanks, Andy.
And I can jump in, Andy. I think that's a really good point. And while it's hard, we can't say who is and isn't on Medicaid, that's where those general strategies to support the general Medicaid population could come in handy. such as offering ways to direct members to state websites to update their contact information. And so while maybe targeted outreach isn't possible, general outreach, I think, could be effective.
And I think we had a comment or a question. Brenna Herman, did you have something?
I had to unmute myself. First, I was nodding my head to the first one, but you couldn't see that. So I've got this together maybe for a minute. I think, yes, we have information and exactly right. We don't know necessarily what plans people are on or who has it. But I think for us, it'll just be working with our local job and family services to get information and to make sure, because we can't assume, because our residents, especially in the high rises, are not on the internet. They cannot fill out things. So I think it'd be really important for us to make sure that we're still providing good flyers and information to post and to have those conversations. And I would think, you know, our strategy would be to include it in our building meeting information and newsletters and things like that to try to make sure that they're doing things ahead of time. You know, we have the same problem with not having good phone numbers and that kind of thing consistently. So that would be our strategy.
Thank you. And now, one thing that I know in discussions with UnitedHealthcare that we also have is they've developed materials as well that we can distribute to you all that are print materials just about this process, how to get in contact, to understand whether people are needing to undergo redetermination and what that will look like for them. So we will be sending that out as well. Emma, did you have anything to add about those materials?
Yeah, I would say, again, Brenna, point well taken that, you know, there's a lot of residents and just individuals on Medicaid in general who don't have digital access. And so how do we make, you know, the redeterminations process or even all of this information the most accessible it can be? And so, as Camille mentioned, there are materials that, you know, direct people to local, either the state or local resources to be able to go through the process, or, you know, if people have questions, then they can that point them in that direction as well.
Great. Does anybody else have any questions or concerns? You know, this is a really great time to kind of bring back to United what concerns you're having about when this process launches. Is there anything that's really coming up for you, and we might be able to have them take it back and help address it? Oh, I have a long question in the chat. From Mary, here in Massachusetts, although our Medicaid program has told us that navigators, certified application counselors, etc., are the places to go to receive assistance with applications, enrollment, finding other coverage, we have found that when reaching out to these entities, many of them do not have the capacity to assist. Don't know much about the PHE unwinding, or can only assist, for example, with only under 65 applications. Are you aware of any other states that have come up with entities that have said they will definitely help, and in what capacity?
Yeah, I think that's a great question. There are some states who are coming up against that exact issue. And so we're seeing those states say, hey, community partners and, you know, payers, can you actually become certified to help people go through the redeterminations process? And so that could be something that I take back, you know, whether that's advocacy or community advocacy as well in Massachusetts specifically. Let me check and see if that's something that the state of Massachusetts has said they would allow others to become community assisters, because I think that could be a strategy for helping alleviate some of that capacity concern.
Wonderful.
Thank you. Yes, absolutely. Thank you very much. I'm glad that it's not just Massachusetts.
Thank you. I thought that was your mom. I'm not sure all about it, Miss Them. I'm sorry. Thank you.
Dr. Nika, are you supposed to be on mute?
Thank you. I'll get
Yeah, it's definitely, Mary, it's definitely not just Massachusetts. We're seeing a lot of states and communities also concerned about capacity.
Yeah, I think even, the idea of partnering with, payers and providers, I think is a really good way to go. So yes, I'd appreciate, looking into that. Thank you.
Sounds good.
Great. And I know that there, in the past, particularly with the launching of the ACA, that there was online trainings for things like the healthcare navigators. If you could provide more information about that in general, I think that would be really helpful. We have a lot of people, a lot of PHAs that provide service navigators who might be able to jump into some of those certification processes. Or they might be groaning and say, I can't add one more thing to my to-do list. Right. Anything else for Emma today? I think this has been a lot of really great information, and we're certainly going to be listening closely to what happens next.
Absolutely. Well, thank you, Camille, and thank you everyone on the line. Really appreciate the questions. And again, if any questions arise after this presentation, please feel free to reach out. And excited to partner and just support our residents and all individuals on Medicaid following the PHE unwinding. Thank you.
Thanks, Emma.
Thank you, Papa team.
I'm putting you on the hook. If you'll continue to send us materials throughout this public health unwinding, and I will be distributing them out to the membership as well.
Wonderful. Thank you so much.
Thank you, team.
Thank you all. Thank you everyone for joining us today. I think this was a lot of really great information, and we'll certainly be working together to continue to address our needs of our residents. Thank you. Have a good rest of your day.
Bye, everyone.